Thanks for joining us for today's Soothing Mama's Woes series. Today we'll be talking about low back pain, a very common ache for new mothers and mothers-to-be. You yourself have probably experienced this. That's why you're here. We'll do a series of stretches and a pelvic alignment series that will help realign your pelvis and get you back in order. Low back pain is caused normally from one of two causes, or a combination of the two. The first being muscle spasms that come from postural changes that are inevitable to pregnancy and beyond. The other is pelvic alignment. In pregnancy, all the ligaments in your body are lax, and your pelvis can change its position relative one side to the other and cause a stronger pain on one side than the other. This affects the SI joints. You may have heard of this already. They're the points at the base of your spine where your spine meets the sacrum. The sacrum is a triangular shaped bone. Women normally have dimples at those points. So if you're feeling your pain there, these stretches and this alignment will be really good for you. We'll start in sitting by opening the legs wide. And the idea here is to stretch all the muscles that are attached to the pelvis, and then to try to realign it in case alignment is an issue. Pull gently the flesh away from the sit bones, connecting the pelvis to the floor, and lean forward just gently. If you're quite flexible, you may be able to walk your hands out and even come down to your elbows. Stay in the range where you feel a strong but tolerable stretch, breathing deeply and continuously. Try to visualize sending your breath to the place where you feel this stretch the most, to will your tissues to surrender and lengthen. Walk up. Slowly bend your left leg in. Slide your right hand down the ankle or inside the leg if it reaches the floor. And take your left hand up overhead, reaching up and over toward the foot, but be sure you're pulling that left shoulder back in line with your body, avoiding this sort of reaching, instead up and over to really stretch out the muscles on the top of the pelvis in the low back. Breathing deeply. Use an inhale to rise. Switch. Straightening that left leg, bending the right leg in, sitting tall, then sliding the hand down toward the ankle or inside, inhaling. Right arm up and over, shoulder back in line with the body. Breathing deeply. You can repeat these stretches 3 times in a row on each side to help relieve low back pain. We'll just do them once now for time's sake. Coming up slowly. Every stretch you want to hold at least 5 deep breaths. That gives your muscles a chance to actually release and lengthen in the stretch. From here, moving down to lying on your back. The first stretch we'll do is just simply drawing the knees in toward the chest and hugging the knees. Breathing deeply here. At least 5 deep breaths. And now place both feet down first, and then take the right ankle up to the left knee. Draw the left knee in toward your chest, threading your hand through the space, the triangle between that right knee and the left, drawing the left knee in toward your chest. If you have a really big belly and are having a hard time reaching around your leg, you can thread a belt around that thigh and pull the two ends of the belt in like this. Again, 5 deep breaths for every stretch. And after the 5 breaths, release, lower down, and switch. Stretching the other side. This is to stretch the piriformis muscle, which is a really deep hip rotator. You should feel this stretch. Now that we have the left ankle on the right knee, you should feel this stretch deep in the left hip. Breathing into the stretch for a total of 5 deep breaths. Good. Releasing. And now, moving to a twist. If you're pregnant, so this, we'll do the deeper version of the twist in for postpartum, but during pregnancy, you should avoid deep twists. So with the legs uncrossed, I'll demonstrate first the pregnant version. Drop the knees gently to the right. This starts to mobilize that SI joint, which is the sacroiliac joint, the place where the spine and pelvis come together. And after 5 deep breaths coming up, I'll demonstrate now the deeper twist that you can do after you have the baby. Crossing your right leg over the left. You can, if you're able, tuck your right foot in behind your left calf, the knees to the left, keeping that right shoulder grounded, breathing deeply. 5 deep breaths here. If you look over the right shoulder, it helps keep that shoulder down on the ground, deepens the twist in the low back. After 5 breaths, unwrap the foot if you had it wrapped, coming out, unstacking the legs. Now we'll do a series to realign the pelvis, using a muscular contraction to do so. It starts with hugging the knees, just drawing the knees in on either side of your belly if you're pregnant, or hugged in tight to your chest if you're not. Holding that for 5 deep breaths as we did. And then placing it down, moving into that piriformis stretch. So right ankle on the left knee, drawing the left knee in toward the chest. Again for 5 deep breaths. And then releasing slowly. Repeating on the opposite side before moving on. So left ankle on the right knee, drawing the right knee now in toward the chest. Breathing deeply. Sending the breath deep to that left hip where you feel this strong stretch. And then releasing. Placing the feet down close to the seat. Press through the feet and lift the hips up as high as they will go, trying to make a straight line from your shoulders to the knees. And again, holding that for 5 deep breaths. This strong contraction bilaterally of both sides of the glutes is what helps to realign the pelvis after you stretch it out with those previous stretches. And after your 5 deep breaths, lowering down slowly and starting it all over again. So you'll start with the hug your knees. and move to the piriformis stretch on either side and finish with the bridge. Again, all for 5 deep breaths. To do this as a treatment for or in prevention of if you've already experienced that pain, you'll want to repeat this 3 times in a row, up to 5 times in a row, 3 times a day. So please do be sure and take the time to do this stretch throughout the day to help ease your woes, Mama.